My name is Mark Speyer. I'm a palliative medicine physician. I work at CDH and Belnor primarily. I want to start off by thanking Living Well for giving me this opportunity to speak with you today. If you have any questions during the talk, please post them in the comments section and we'll get to them in the end. My topic today is advanced directives, but I first want to talk about what palliative medicine is, who we are, what we do. Palliative medicine, first and foremost, helps patients with quality of life. We do this by focusing on symptom management. We help with physical symptoms like pain, shortness of breath, nausea, vomiting, constipation, psychological symptoms like anxiety or depression. Sometimes people need some social support, so we have a social worker on our team. And at times people can have spiritual or existential suffering, so we have a chaplain on our team to help with that. So our goal is to focus on attacking all suffering from all angles by a whole person approach. We specialize in chronic progressive diseases like cancer, heart failure, advanced lung, liver disease, dementia, to name a few. But we also help with discussions when there's a fork in the road as far as further treatment options. So let's say someone with cancer is deciding whether or not to have a second or third round of chemotherapy. Someone with heart failure is deciding whether or not to have a pacemaker put in. We can help with those discussions. Because sometimes the medical world moves very fast, and it can be like a bulldozer. Our job is not to stop that. It's just to put a pause or brakes on that machine, just so we can stop and think, hey, is this something that you want to do? Are you okay with what we're doing? And the answer, if it's yes, then great. We will support you and walk with you in this journey. If the answer is no, we'll talk with your primary team and see what we can do to come up with a solution. Many times it's a more comfort-based approach. One of the things that we can also help with is when you're first diagnosed with a disease, we will follow along and act as a support system. So for cancer, for example, when you're first diagnosed, you may have some pain. We can help manage the pain. If you have some nausea that's related to the chemotherapy, we can help manage the nausea. As the disease progresses and there's less and less that the curative model can provide, then we can take more of a front seat. If there's no further curative options left, or if the patient or family wants to focus on quality of life and more of a comfort care approach, that's when a form of palliative medicine becomes available called hospice. And hospice is the same goal, it has the same goal as we do, and that's to improve quality of life, and with acknowledgement that we don't know how much time you have left, and there's no reason why we can't make that the best possible time, and you'd have a whole team of people to help with that. So the reason I'm bringing that up is many times palliative medicine and hospice are used interchangeably, and that's not necessarily accurate. So on to advanced directives. We're living in a time right now where we have incredible medical advances. We can do things that were not possible 50 years ago. With that, we sometimes run the risk of doing things to patients that are at end of life that can potentially threaten their dignity or compromise their quality of life. You have a right as a patient to decide how you want to be treated. You can determine the type and level of care that you want, but that has to be communicated. As long as you have the ability to do so, then you should communicate it. But there are times where you will not be able to speak for yourself, and that's where it's an advanced directive comes in to play. This is a topic that is sometimes uncomfortable to talk about, and many patients and families sometimes say, I'm not ready to discuss this right now. When the time comes, I'll deal with it then. But it's important to know that the time to talk about it is when things are stable, when you can think rationally about what you want and what you don't want, and that way you can make a good decision moving forward. It's not the time when emotions are really high. It's harder to make a good decision during that point. For example, if you know for a fact that you don't want to be on a breathing machine, you say, I never want to be on one, I just don't like them, I never wanted to be on one. You can document that, and that would go on to a living will, and you can communicate that with your family, friends, and healthcare providers, and they should honor that. In Illinois, there are 4 types of advanced directives. The first is what's called a durable power of attorney, and I'll talk about these a little bit more specifically in a minute. The second one is a living will. The third is what's called a POLST form, P-O-L-S-T, and that stands for Practitioner's Order for Life-Sustaining Treatment. And finally, the last one is mental health treatment preference declaration, which I'm not going to really be focusing on that. I'm going to be focusing more on the first 3. So as far as the durable power of attorney, that is also known as the healthcare power of attorney. In this advanced directive, you will select someone who will make decisions for you if you're ever unable to do so. This is different than a financial power of attorney. Many times people have 2 separate people to handle 2 different functions. So you can have someone that handles your financial issues and another person that handles your medical issues. Typically, people choose someone that is a family member or a close family friend for a power of attorney for health care. You cannot choose a provider or healthcare professional that is currently taking care of you. As long as you have the ability to make decisions, you will continue to do so. If, however, you land in a situation where you're not unable to, so let's say you have a stroke or you're in a coma and you cannot speak for yourself, that's when the power of attorney would be activated. That's why it's so important that you speak with your power of attorney about your wishes. You may say, I definitely want all of this done, I definitely want to avoid certain things, and you should communicate it with them. Therefore, they can really work on your behalf and act out your goals. The other thing to remember is that you want to pick someone who will be emotionally able to handle this, because sometimes there are some tough decisions that need to be made, and you want to make sure that they carry out your wishes. In Illinois, there's something called a Surrogacy Act, and what that is if you have never selected a power of attorney or you don't have any advance directive, they will select a surrogate or someone who will be able to make decisions for you. And the way that works is it's kind of like a hierarchy. They'll first see if you have a guardian. If you don't have a guardian, they'll go to a spouse. If no spouse is available, they'll go to adult children and then to parents, adult siblings, adult grandchildren. So it's a stepwise ladder approach on who will be able to make decisions for you. If you know there's a certain person who you don't want making decisions for you and they may be higher up on the ladder, that's why it's so important to appoint someone that you know will act on your behalf and carry out your goals. So that's the durable power of attorney. The next advance directive I want to talk about is a living will. And in this advance directive, a person is not appointed to be the decision maker. You fill out what you want done on a document. You can either make your own document, or there's some prefabricated documents that you can fill out with certain choices of what you want done or what you don't want done. This is for people who have irreversible disease or incurable disease, and you want to make sure that certain things are not done to delay the dying process that might prolong suffering, and you want to avoid certain things, certain interventions. The next is the POLST form, the Practitioner's Order for Life-Sustaining Treatment. Again, this does not appoint a person to make decisions for you, but it is a form that you fill out. And unlike the living will, this is an actual medical order. You need a physician, a nurse practitioner, or physician assistant to sign the form, and then it becomes active in addition to a witness signing it. So this is a form that you carry on with you through different places in the medical world. So let's say you're at home and you have decided that you want to not be resuscitated by CPR, by chest compressions. You're a do not resuscitate DNR. You can list that on the form, but if somebody still calls 911 and the paramedics show up to your door, if you have that posted on the refrigerator, they can see that those are your wishes and they would have to honor them. And then comfort measures would be initiated at that point. Or by the same token, if you go to the hospital and you have a POLST form and you have selected that you want to have chest compressions, you want to be on a breathing machine, then they would have to honor those wishes. So it's an important thing to have. Typically, the forms I have on here, this is a pulse form, and they're typically very brightly colored, so you can see them when you're looking for forms. And you just go down the list. You first mark if you want chest compressions or you don't want chest compressions, and then it goes to the next tier where you might want selective treatment, which means that I want IV antibiotics, I want IV fluids, but I don't want to be on a breathing machine. I might want less invasive techniques to help me breathe, something like a CPAP. And then finally there's the comfort measures. So you can pick which ones you want, and also there's a section here for tube feeds and artificial nutrition. You can plan that out as well. This form is not for everybody. It's for people who have a very serious illness, or if they're extremely frail or elderly, and it's not for people that have a long life expectancy. So also the intent of the form is not to replace a power of attorney, but it's to be an adjunct to that, which they can refer to it if needed, if you're ever in one of those situations where you cannot speak for yourself. Some final points on where to find these forms. You can ask for them at your doctor's office. If you're admitted to the hospital, there are forms available for you there. We're going to see if Living Well can have them when Living Well opens up. You should be able to get some of those forms. But also, you can download these forms from the internet at the Northwestern Medicine website or at the Illinois Department of Public Health website. Just do an advanced directive search and these forms will pop up. You can download them and fill them in. It's very important that if you do have one of these forms, to bring them into your doctor's office, or if you're admitted to the hospital, bring them into the hospital so that we can scan them into the computer and let everybody know your wishes and make sure that we follow them correctly. If you need help filling out these forms, certainly that's something that palliative medicine can do. One of our core functions is to make sure that we're doing what you want us to do. But you can have help from your primary doctor, your oncologist, a social worker. A lot of different people can help you with these forms. And more importantly, make sure that a family member is involved and knows your wishes. That way it makes it a little bit easier. Finally, I want to mention that these forms are not written in stone. So if you're filling out this form and you are done with it, you have it signed and it's scanned, and then a couple months later you say, I changed my mind about one of these things. They can always be revised and changed or canceled. It's really meant to be what is the most current treatment plan you have in case you were ever unable to discuss what your wishes are for yourself. So at this point, I want to see if there's any questions from anybody. We can answer them.
So, Dr. Speyer, how would a patient go about getting a palliative consult? Is this something they would call directly, or would they go through their primary physician they're seeing?
So the best way to do it is talk to your primary physician or oncologist, and they can put in a referral, and then we will see them in clinic, or if they're in a hospital setting, we'll come and see them as a consult in the hospital.
Thank you. And when you talk about advanced directives, should a patient complete those? Are they honored if they move from their home hospital and have care at a different hospital or even out of state?
So that's what's so important about the POLST form. The POLST form, as I stated before, is a medical order, and that will follow with the patient. The other advanced directives are sometimes open to interpretation. So if you want to be absolutely sure that you will have your wishes followed, then the POLST form is the way to go. But typically, people really try to follow advanced directives, and that's something that families can draw upon when they're making some of these difficult decisions.
We did have a viewer ask a question. She's the POA for health care for her uncle, who is 84 and at end-stage renal care. What would palliative care look like for a patient who decides to stop dialysis?
Okay.
At times, he says he wants to do this.
Yeah. So one of the things that we can help is discuss this further with the patient and let them know what this would look like. If you stop dialysis, if someone is dialysis dependent, we're looking more at a hospice route at that point. Typically, people who stop dialysis don't really live that long, much more than a week or two. But we can help facilitate those discussions, and he could still have excellent care through hospice, and that's something that we can help discuss what hospice looks like and help facilitate the transition to hospice.
Another viewer is asking, what if your form says you never want to be on a respirator and COVID comes along and the respirator is a good idea? What happens?
So that's one of those situations where if you feel strongly that you want to be on a respirator temporarily, you can do that. I have to say that with COVID, we've seen a lot of people who are not able to get off of the respirator, the ventilator, and then it falls onto family members if they're not able to make that decision about taking them off of the ventilator. But there are times now that people do come off of it, and if you feel strongly about that, you can alter your advanced directives to reflect that you do want to be intubated if needed. And then if the time passes, you can always go back to how they were before.
A viewer is asking, what is the mental health declaration?
Okay, so that is if you have mental health diagnosis, whether it's depression or schizophrenia or something like that, it's written instructions about how you want people to give you treatment based on your prior decision. So it's kind of like some of the other advanced directives, but specifically for mental health issues. If you want to be brought to an inpatient facility, what types of medications you want, if you want psychotropic medications, that sort of thing. So you can delineate what you want and what you don't want, but it's strictly for mental health.
When did the mental health declaration come about? It sounds like it might be newer.
It's been around for a little bit, but a lot of people don't know about it.
And then I'm going to ask the question, does insurance cover palliative
Yes.
consultations?
So palliative medicine is just like any other consult service. If you're seeing cardiology or GI or rheumatology, it's all covered under insurance. We're a consult service just like anybody else. We don't replace your primary doctor or oncologist, but we work as an adjunct to them, and we specifically deal with the things that I was talking about, like symptom management or discussing your goals of care.
I don't think we have any other questions.
Great. Well, thank you everyone for joining me today. I appreciate everybody's time, and just make sure that you continue to follow Facebook Live for Living Well, and we'll have other sessions for you in the future that are cancer-related topics. Thank you very much.